Hi, Dr. Vo here. I'm a board-certified cataract and refractive surgeon. In today's video, I'm going to discuss a topic that's a little bit different than what I usually talk about, and that's AI YouTube channels. AI stands for Artificial Intelligence, and these are basically computer-based machine learning systems that can be used to create and automate the process of making YouTube videos. My concern specifically is with AI doctor YouTube channels. These are channels where they are producing content and they are pretending to be real physicians. There's no one vetting or regulating these channels, and so the content being produced and being put out can be inaccurate. In today's video, I'm going to show you a few examples of ophthalmology AI channels, and I will show you just a few examples of where the information is just wildly inaccurate and full of mistakes. AI is still in its early stages, and so the content being produced in the future, I imagine, will be even more realistic and even more believable. So let's go ahead and just get into it. I'll show you some samples of these channels, and then I will briefly discuss how, I, as a viewer, would try and vet these channels to make that distinguishment. Is it AI channel or is it being produced by an actual physician? Let's go ahead and take a look at the screen. This is the first channel. This is Dr. Jonathan Harris. It looks very professionally made. It looks very well done. And I'm going to show you an example of the channel's most viewed video. I'm going to show you a clip here, but it says, "My vision got blurry again after cataract surgery. What nobody warned me about." And to just give you a brief summary of the video, but they talk about PCO, which stands for posterior capsule opacification. If you don't know what that is, after cataract surgery, you can develop some essentially kind of like scarring, but you can develop a thin film on the back of the lens implanted. And this is what we call PCO, and it's treated with a YAG laser. And this video talks about that. There are parts of the video where the information I would say is accurate, but I'm going to show you a few highlights in this video where the information definitely makes no sense at all. Let's just go ahead and take a look at this clip, and it will kind of highlight why I think these AI doctor YouTube channels are such a big issue, especially in an era where so many people are getting their information from online.
What happened, the 5-minute laser fix that puts it right, and the rare risk most patients are not warned about. I'm Dr. Jonathan Harris, board-certified ophthalmologist, 18 years in practice, somewhere around 9,500 cataract and refractive procedures behind me. I'll be straight with you.
So this is probably my biggest issue with the video, is that right from the beginning you can see that this channel, they're claiming to be a real ophthalmologist, board certified, 18 years in practice, and 9,500 surgeries under their belt. And so by making that statement, they are trying to establish their credibility to provide this information to you as the viewer. And if you as a viewer don't know that this is not even a real person, you may just take their word for it, and the information that's in the video, you may believe that to be very accurate and true. So let me go ahead and show you. I'm going to skip ahead. I have a few timestamps here, so I want to show you some blatant areas where the information is just very inaccurate.
The natural lens is gone, removed in the original surgery, never to return. What has come back is biology doing what biology does on the back wall of a now empty bag. 20 to 50% of cataract patients develop clinically significant PCO at some point, most commonly between 6 months and 5 years post-op, with peak incidence around.
So this is the first area where the information just makes no sense. But like I said earlier, PCO stands for posterior capsule opacification. And here they use a figure that says common PCO misconceptions and facts. Number 1, infertility is guaranteed. Number 2, cysts are always present. Number 3, it only affects women. 4, weight loss is the sole treatment. Now, the glaring issue with this figure is that it is talking about PCOS, which stands for polycystic ovarian syndrome, which is also a real condition, but not related at all to PCO of the eye. Obviously, whoever created this content and made this video, did not review it at all, because this figure makes absolutely no sense when we're talking about PCO for a cataract lens implant. Again, I'm going to show you another, I'm going to skip ahead to another timestamp. Let's see here.
Exception 4. I should just live with it. Maybe. For a while. If the PCO is mild and you are not symptomatic, watching it is reasonable. But once it interferes with your driving, your reading...
So again, just another figure here that makes no sense to the topic being discussed. It says PCO, treatment indicators, irregular periods, excess androgen signs, polycystic ovaries, acne or oily skin, and weight gain. So again, just makes no sense. Blatantly, inaccurate and not related at all to PCO. And patients watching this or viewers watching this may not realize that. Obviously to me as a physician or any physician watching this would quickly be able to identify this, but I think for just a common layperson watching it, they may not pick up on it, and they may think that their information being presented is accurate, right? After all, this is someone that claims to have 9,500 surgeries under their belt and 18 years of experience. If we go down to the video down here, you look at the comments, overall they're very positive, and I think that's like one of the big things that is concerning to me, is that it's very clear that a lot of the people watching this channel think that it's a real person, it's a real doctor presenting this information. Now, YouTube does have requirements that, if it is AI produced content, it should be labeled, and the channel does carry those labels, and I'm going to show you here. You look down here just below the title of the video, it says AI. If you expand the description, it has this little line that says made with AI. And I think it's great that there are labels, but again, one, they're tiny. And so I think it's very easy for someone watching this either on their phone, or maybe you're watching on the TV, you probably won't see the labels. My second issue is that nowhere in the video do they make that disclaimer that this is AI produced content. I think they are intentionally trying to pass it off that this is a real physician so that you as a viewer will watch it. If you knew it was AI, you'd be much less likely to watch it. Again, here's the channel page. Looks very well done, tons of videos. And I think that's the other kind of red flag sign with this, is that if we go to their oldest video, it was only 2 months ago. And at this point, they've already made 54 videos. 54 of these very professionally looking videos. They all look like they're very well made, but clearly there are a lot of issues with the content in the video. Another example of an AI YouTube channel for ophthalmology specifically, I found that is this channel. This is Dr. Karen Holm, Senior Vision Hub. And I'm going to play a short clip here.
You pay an extra few $1,000s for a premium toric lens to fix your astigmatism during cataract surgery. 3 months later, you are seeing worse than you were before the operation. 1 degree of rotation off axis costs you 3% of the correction you paid for. 30 degrees, and the lens is doing nothing for you at all.
So this video, they're talking about a very important topic, and that's like toric lenses and how it is used to correct the astigmatism. But if you go through the video and you look at it carefully, there are just areas in the video where there's just some very blatant inaccuracies.
And the marks line up.
Okay, so here, this is a diagram of the eyeball, and it has a bunch of labels, but the labels really just make no sense. You can see here at the top, it just says toric intraocular lens, and it is pointing to the ciliary body of the eye. Here it says iris OI pupilla, and it looks like it's just pointing to the retina. It says the crystalline lens is here, but this is the optic nerve. This is down here is the vitreous body, but it's pointing to the choroid. So again, figure makes absolutely no sense. Any optometrist, ophthalmologist, and even anyone I think with a educational background would quickly look at this and just realize that it just makes no sense. Clearly not being looked over by a medical professional. It's just a very horrible diagram to be using. I'm going to go ahead and jump ahead again and show you one more clip in the video.
Standard pre-op workup may not detect. Form fruste means
here's another diagram. Just take a look at it. You'll see there's just tons of typos. It makes no sense. Epithelium, spelled wrong twice. Stroma, spelled incorrectly. And a couple other nonsensical words. So just very inaccurate diagram. And, I think, with these videos where they're pretending to be real physicians and they're not vetting in any of the information, it can be dangerous. For this video, I don't think anyone's going to get hurt from it, but I think the fact that they are presenting information and they're pretending to be real doctors is incredibly dangerous. It's just a matter of time before someone gets hurt watching one of these videos. They hear something and maybe they follow the advice of the video and they may find themselves in some sort of trouble. Looking again at the channel, it has the labels though. It says AI here. I think the channel actually does a little bit better job of labeling the fact that they're AI. You can see here they have a disclaimer. It says Dr. Karen Holm is a senior vision wellness educator and AI generated educator persona, not a real licensed medical doctor or surgeon. So I think they use this disclaimer though more so to protect themselves, not really to inform you the fact that it's AI. They want you to think it's a real doctor, right? They don't want you to think that it's AI, but they have the disclaimer there to protect themselves. And I can see, the target audience. Generally people watching this video will probably be like yourself, getting a little bit older. And it's hard, even myself watching this video, it's hard to tell that it's AI unless you really kind of dig into it and look carefully at some of the red flags. And so how do we identify whether a channel is AI versus being produced by a real doctor? Again, I talked about the AI labels that YouTube does have, which, kind of small in my opinion. I think it should flag at the beginning it is AI, but currently does not. Another thing that you can tell, again, like the previous channel that we saw with Jonathan Harris, this channel has only been around 2 months and they've produced 46 of these very high quality looking videos. Another sign for me is that all these channels have these thumbnails that all look very similar. Okay, they have different topics, but they all look very similar. And the thumbnails that they use, you can tell that the images being produced are all produced by AI. Last thing you can do, if a doctor has such a big presence, you should just Google their name. Look on Google, see if they're a real person. Pretty much every doctor out there practicing, you'll be able to find their footprint somewhere, okay? You should be able to find more information about them if you search for them online. For ophthalmology specifically, you can go to the American Board of Ophthalmology webpage here, and you can search and look up and see if they are board certified, and see if they're a real doctor. So, for example, we can search up Jonathan Harris here. Jonathan Harris. And there is a Jonathan Harris. But if you search him, you'll see that this individual is deceased. So Jonathan Harris, real ophthalmologist, but this particular individual, is deceased. So whoever this is producing this channel is just pretending to be a physician, not a real ophthalmologist. And the other thing that you can also look for is that on YouTube, if the channel is produced by a real physician and they have a decent sized channel, it probably will carry a label that says that it is a doctor license in the US. I'm going to show you my own channel, for example, to show you how this label looks. It's just an ad. But you can see down here, it says here, from a licensed doctor in the US. So the label is here, tells you that it's a real doctor, and you'll know quickly that this is a channel produced by a real physician. There are other YouTube channels that I think are great for YouTube ophthalmology content. They're produced by real doctors that I respect. Some of my favorite ones are Dr. Michael Chua, Dr. Shannon Wong, Elon Cohen has a great channel, and of course Uday Devgan, very, very great resource. His channel is more so, I think, geared towards practicing ophthalmologists, since a lot of it's covering surgical techniques. I think there's still a lot of valuable information for you as a viewer or as a patient. And that basically concludes my video on this topic. AI YouTube channels, didn't know it was a thing up until recently. A little bit disturbed, a little bit concerned now that I do know it's a thing. Very misleading. I can easily see how someone can watch this and think that it's a real physician providing the content. And for myself at least, I'm worried because it's easy to see how someone watching this video may take the advice and may do something that maybe isn't in their best interest because they think that the person providing it is a real doctor. If you found this video helpful, or if you're like me and you found this video topic a little bit disturbing, please let me know down in the comments. I would love to hear from you. If you found this video helpful, please make sure to like and subscribe. If there are topics that you would like me to discuss in the future, please let me know. I'm always open to covering new topics, so you have something that you want to see discussed and you just haven't seen in other videos, please just let me know. I'll try and get around to it. And as always, thank you for taking the time to watch. I'll see you in the next video. Take care. Bye.